On a monthly basis, an amount of 400 cedis is paid as allowances to students in the nursing and midwifery training colleges. Though many have argued the relevance of the allowances, the present government continues to assure students of willingness to pay, hence its restoration after taking over power. Victor Abiri Awene is president of the Students' Representative Council at the SDA Nursing and Midwifery Training College in Kumasi. He is able to keep himself in school from the money he makes by working at a pharmacy shop with support from family and the monthly stipend from government. During the last clinical practicum, Victor was unable to fully fund transportation to the hospital and to feed himself, leading to absenteeism sometimes.
This unpaid allowance, it has affected me a lot. Because personally, I do pay my fees with a little support from the family. Okay, so I depend solely on the allowances and other activities that I do at home. Some other educational activities that I do, which will generate money for me. So it do force me and other colleagues of mine not to go for clinicals, because going to clinicals you have to go for money to rent. Also, we have some educational visit, which we who don't have money to support ourselves, do fail to go for such educational visit. So how are you going to explore or give out our best when you're doing the paperwork? I mean the exams. You do fail exams because of all these things. Because one, have to go to work and practice. Okay, I do go to clinicals when I get money. But anytime that I don't have money, I don't have I can't have access to the car to go there.
For 11 months, Victor, like other trainees, have struggled their way through school. At the moment, he is skipping class to increase work hours at his part-time job to enable him deal with 5,000 cedis he owes in school fees.
Okay, if government fails to fill all my areas, then I will be tempted to do much. Okay, like assuming the little that I'm doing, I'll be forced to do something bigger than that so that I can support myself, because I cannot boycott the school. Some of my colleagues, especially me, I work with one pharmacy. Okay, so I have to go there weekends and also check my timetable. Those courses that I know I'm good at, I have to skip them small so I can get a little money to come. Because if it means staying on campus, I'm not happy. So what mentality do I use to go to class? Okay, so I have to go home and do other things, like to go and work with the pharmacy, so that at the end of the day, I'll get my PhD and come back to campus to work so that I can survive.
Continuing students at nursing training colleges are owed 11 months arrears of allowance. Newly admitted students are owed 4 months and rotational nurses are owed 9 months. The leadership of the students says many of its members are unable to cater for their education due to poor finances. They spoke at a press conference.
For too long, we have been taken for granted. For too long, our needs have been left unattended. For too long, our pleas have been swept under the carpet. As an association, we are abreast with the development in the country, and we are well aware that of the engagement of the government with the International Monetary Fund, IMF. We also understand the government has a proposal to be vetted by the Fund for Economic Growth. We would like to indicate that we aren't expecting our allowances to be affected in any way. And there can be no reason for such a thing. Looking at the philosophy of the fund, interested in cushioning those who need help, we believe strongly that there won't be anything that will against the cushioning of allowances to trainees to survive. Any attempt to cancel the allowances in the quest for the bailout from IMF will face the fiercest resistance of the trainee nurses and midwives.